Hi everyone, I'm Jade Yehia. I'm Island Health's Healthy Built Environment Consultant, and I'm really happy to be here today at the Public Health Association of BC Summer School to be presenting to you or facilitating one of the breakout discussions on what is a sustainable, just, and healthy local housing system. So I wanted to start by opening it up and posing the question is, what is our current opportunity to link health and the built environment? As we're thinking globally but acting locally, um, what is our impact to positively connect those dots between health and land use planning? Those dots that we know so innately to be true in the research. The built environment has such a significant impact on our health. Community design can impact traffic safety and injury prevention, neighborhood walkability, access to public transit, if you have that access in close proximity to you. Um, we know the mental health impacts of the built environment, and there's emerging research coming out on this, but definitely concretely that connection to noise. Do you live next to a busy roadway? Do you have an industrial activity next to you? These have all been attributed with sleep disturbance and excessive stress. What about the air that you breathe or the water that you drink? Do you have access to safe and potable water? Healthy foods in close proximity to you, community gardens, affordable local grocery stores, farmers markets. What about social inclusion or exclusion in the built environment? Thinking about health equity and creating spaces that are accessible to all, access to affordable and safe housing. The COVID pandemic has really placed a lot of these aspects of the built environment under the magnifying glass. Chronic disease findings tell us that people living in a walkable area are 42% less likely to be obese compared to those living in a car-dependent area. And people living in an area with many parks are 39% less likely to have heart disease compared to those living in an area with no parks. And I think thinking about parks, we could all, just as of late, probably prior to, but attribute parks as being places of solitude, refuge, and escape as we've all been isolated in our homes. So is it all just about behavior change when we think about public health? A lot of public health interventions have been around those behavior changes, those modifiable risk factors of health. But health promotion approaches that have focused only on education and individual behavior change have had limited success. It's about building in and designing healthy living, about creating healthy choices being easy choices in our backyard. I think in this time that we're in, there's all this space of opportunity as well, changing lives for the better and protecting the climate. For example, helping your city invest in cycling infrastructure to improve public health and cut emissions. It's this concept of multi-solving that's been shared with me, where we're finding solutions rooted in equity that reduce fossil fuel use and produce co-benefits in health, resilience, and well-being. We know chronic disease is overwhelming our healthcare budgets. So what is our bounce forward to that new normal? What are those things that we can do independently and as a community locally to bring a health, climate change, and COVID lens to land use planning? For example, we're seeing those opportunities, closing streets for active transportation, finding new ways to socially connect, finding shelter for those without, air quality improvements through banning of open burning, and there's so many takeaways for climate change, putting people's health and well-being first, no exceptions, and isn't public health under the magnifying glass right now in the best way possible. I look forward to sharing this with you more in our breakout session. Thank you.